welcome to Just Upright. My name is Doc Jing Ruder. I'm a doctor of physical therapy and I'm a certified dementia practitioner. Thank you for watching. Thank you for all the subscribers. Thank you for all the viewers. If you haven't subscribed yet, I would really appreciate if you hit that subscribe button and the bell button so that you will be updated with the latest video update and upload that we have here at Just Upright. So if you haven't gotten to the channel yet, I make videos on how to become physical therapists here in the US for foreign trained physical therapists. I have useful videos for older adults, how to prevent fall, health information, and also videos on how to become an on-call or PRN physical therapist, and just inspirational videos in general. So check out the channel. Also, please check out my books. They are available at Amazon.com. The links are down below. If you are a foreign trained therapist, physical therapist, and want to be guided on the step-by-step process on how to become a licensed physical therapist here in the US, this book is for you and it has good reviews on Amazon.com. The next book is Practical Tips for Therapists Prior to Migrating or Starting Your US Practice. This book is full of wisdom for you to be psychologically and professionally prepared before embarking into your US practice as a therapist. The third book is Just Upright, Practical Tips to Improve Posture, Balance, and Decrease Fall Risk. These are for older adults with practical exercises you can do at home modification program, and priceless information that may improve your life and enjoy your retirement years. And these are also for clinicians. I have Clinician Corner here that has standardized tests backed up by research studies and other evidence-based practice that you can use and utilize in your clinical practice. Check our website, justupprighttherapy.com, and if you hit the courses or coaching, you will see there that I offer one-on-one coaching for newly graduate or foreign trained physical therapists who want to be guided on how to do documentation or clinical decision making, and it's available here at justupprighttherapy.com. You can view more and you can schedule an appointment for me. And also I have a course here available, Practical Tips for Physical Therapy Evaluation Documentation, and if you click view more, you can see the curriculum here. It will walk you through from PT evaluation duration and the parts of evaluation, chart review, past medical history, so on and so forth, down to the frequency of treatment. So practical information that you may want to have, you may want to learn before you embark into the therapy world, available at justupprighttherapy.com. So I got this message from Ollie Belly. It says, hello, recently found your channel. Also, I just graduated from BSPT. I found your content very helpful. Thank you so much. I've been having trouble deciding what I want, like go abroad with or without a DPT, and how that would have effect on my salary. Can you make a video of the standard salaries of PTA, DPT, PT Aide, and living expenses compared to PH is the Philippines? It would be a good content for those who cannot decide like myself. I also have plans to go back to the Philippines and pursue med school. Thank you so much. Okay, so this is what we're going to answer. But first, we have to define, for those of you who do not know, what's the difference of PTA, physical therapy assistant, and physical therapist, okay? So let's jump into it. First, the physical therapist aide, okay? What is a physical therapist aide? So here, this is a money.usnews.com that I use the definition. They support physical therapists and physical therapist assistants by cleaning and sanitizing treatment areas and equipment, washing linens, and performing clerical tasks. They also usually responsible for moving patients to and from treatment areas. These professionals are crucial to a well-run physical therapy office. Okay, so according to Bureau of Labor Statistics here in the US, the physical therapist aide, okay, usually need a high school diploma or equivalent and on-job training. Now, what is a physical therapist assistants? What do they do? Okay, so this is from APTA, American Physical Therapist Association. Okay, physical therapist assistants provide physical therapist services under the direction and supervision of a physical therapist. PTAs implement components of patient care, obtain data related to the treatments provided, and collaborate with the PT to modify care as necessary. PTAs assist the physical therapist in the treatment of individuals of all ages, from newborns to people at the end of life. Many patients have injuries, disabilities, or other health conditions that need treatment, but PTAs also care for people who simply want to become healthier and prevent future problems. According to the U.S. Bureau of Labor Statistics, physical therapist assistants entering the occupation typically need an associate's degree from accredited program and a license or certification. So who are the physical therapists and what do they do? Physical therapists are movement experts who improve quality of life through prescribed exercise, hands-on care, and patient education. So again, this definition that I'm reading right now is from American Physical Therapy Association. Okay? Physical therapists diagnose and treat individuals of all ages, from newborns to people at the end of life. Many patients have injuries, disabilities, and other health conditions that need treatment, but just like the PTA, physical therapists also care for people who simply want to become healthier and prevent future problems. Okay? Physical therapists examine each person and then develops a treatment plan to improve their ability to move, reduce or manage pain, restore function, and prevent disabilities. Physical therapists can have a profound effect on people's lives. They help people achieve fitness goals, regain or maintain their independence, and lead active lives. Okay, so just to simplify the job description of each professional. So when you're a physical therapist, you're the one evaluating the patient. You are the one reviewing the chart, all the past medical history, the medications, the precautions, and developing or establishing the goals, okay? And physical therapists are the one doing the major paperwork, such as physical therapy evaluation, re-evaluation, discharge summary. So those paperworks are being completed by physical therapists, okay? Now, the physical therapist assistants are the one treating the patients as well, okay? So physical therapists can treat the patients, physical therapist assistants can treat the patients. The physical therapist assistants are under direction and supervision of physical therapists. So they carry out what's in the plan of care, okay? So they can perform therapeutic exercises, gait training, or ambulation or walking, transport training, neuromuscular education to the patient education, okay? The physical therapist assistants can also write progress notes, okay? At least here in Missouri and Illinois, the physical therapist assistants can write progress notes, okay? Or the therapist assistants progress notes, okay? So it all depends on where you're practicing, what state you're practicing, and the Practice Act in that state. Now, the physical therapist aide cannot treat any patients, okay? So they are major support to the rehab department, but they cannot carry out any treatment to the patient. So those are just like an overview of the differences in the job description or the function of each profession. For the paycheck, the salary, okay, what is the difference of the paycheck? For physical therapists, salary, okay, according to this Bureau of Labor Statistics, the median annual wage for physical therapists is $91,010 in May 2020. But you have to understand that this is greatly affected by the state where you're practicing. Each state have different average salary, okay, and also what facility you're practicing. Is it skilled nursing facility? Is it outpatient? Is it school? Okay, is it hospital? Because different facilities also offer a variety of wage or paycheck or salary, okay, depending on where you're working. For the physical therapist assistants, okay, according to again Bureau of Labor Statistics, the median annual wage for physical therapist assistants was 59,770 in May 2020. Okay, now the physical therapist aide, the median annual wage for physical therapist aide, if we look here, is 28,450 as of May 2020. So side-by-side comparison, so the median annual salary for PT aide is 28,450, for PT assistants is 59,770, and for PT 91,010. Okay, again, this is according to Bureau of Labor Statistics. So between PT aide and PT assistants, there's roughly around $30,000 difference, and between PT assistants and PT, there's roughly around $30,000 different annual salary difference. Between PT aide and PT, there's roughly around $60,000 different. I know some of the fellow Filipinos are working as a PT aide while they're trying to earn their license as physical therapists. They were trained as physical therapists in the Philippines, but for some reason they are not yet licensed here in the US, or they're working as physical therapist aide or physical therapist assistant. Okay, so which is nothing wrong with it. You know, you're working, you're earning your money in an honest way. That's good. But if you are a foreign trained physical therapist, you're licensed in your own country, you were trained to become a physical therapist, and the only thing that's stopping you from getting that license is the fear of failing. Okay, the best thing to do, as they say, if you're fearful of something, is to face it. Okay, you have to really study hard, you have to review as hard as you can, get all the tools and materials that you need in order for you to pass the National Physical Therapy Examination, okay, the NPTE, so that you can get that physical therapist license that you were trained for. Okay, so because there is a huge difference in paycheck, okay, between being a physical therapist assistant and being a physical therapist. Okay, again, there's nothing wrong with the job, okay, but if you are trained and graduated as physical therapist, of course you want to practice as physical therapist. Okay, so I hope that this video is helpful for you guys. If you have any more suggestions or questions, videos that you want me to do that will be helpful for you and our colleague, our practice in physical therapy, just let me know and I'll do my best, just like this one, to answer the question and present to you the information that you need. Thank you so much for watching and stay blessed. Okay, so as we have seen in the now, according to Department of Labor and Statistics, my books are just up right there. Thank you so much for watching. Please do not forget to hit the subscribe button below to be updated with the latest video releases. Share this channel to other people you know who will benefit from Just Upright videos. Thank you again and stay blessed.